The next question, and let's see, who did I start with the last one? Okay, Mr. Petersen. Do you support or oppose the Obama HealthCare plan? And what do you propose we do to provide affordable health care to all our citizens?
That's an easy one. I oppose it for a very simple reason. I'm in favor of single-payer health care for all. Getting kids, sniffling kids out of schools and getting them to doctors. And getting the, 46 million people in the United States, even after the Obama health care reforms. 46 million people without health care in the richest country in world history. Every other Western country has managed to deal with this to at least some degree of success. Some, like Canada, are having trouble. Some, like France, are going really well. The United Nations says France is the #1 healthcare system. It's also single payer. They take care of foreigners if you get sick there. The American Association of Retired People, recent magazine, ARP, they go into 5 places to retire. 3 of them are single-payer countries, Italy, France, and Portugal. If a magazine like that is encouraging Americans to retire overseas for the health care, that says something about our health care system and the future of it. It's a sobering statistic. Cuba has a longer expected lifespan than the United States. Cuba, which has been under all sorts of hammering for various things, whether you like their health care or not, they've got a longer life expectancy than the United States. We need single payer as soon as we can get it.
Mr. Farr, same question.
I'm a co-sponsor of the single-payer plan. Unfortunately, I didn't have the votes to get it adopted in the Senate, and therefore we couldn't do it. You don't always get your way in Congress. When you have to vote on tough issues, it's an up or down vote. It's not, oh, I vote for it if we have all these other conditions on it. You have to make a decision. Is this 51% good or 51% evil? Because there's a little good and bad mixed in all of it. Frankly, the healthcare plan did 3 things that are very necessary in the country. One is to stop the incredibly escalation at 15% a year in healthcare costs. It was bankrupting the private sector, it was bankrupting government. America, without that change, would be in 10 years paying 26% of the GDP on healthcare. There's no industrialized country in the world that pays more than 12%. So all the money that we want to put into research and other kinds of things, we wouldn't have, because we'd all be spending on healthcare. We had to fix the broken system. We also had 37 million people uninsured. We also shifted the cost from you, the taxpayer, and you, the premium buyer, to everybody. Everybody has to pay for something. There's no free lunch in this bill. Everybody has to be covered with insurance. I think it was the best plan that could have come out of a compromise. It's supported by the California Medical Society, supported by most of the interfaith religious groups of being able to bring fairness and equity and accessibility to healthcare. And frankly, my daughter died, my sister died visiting me in the Peace Corps because she didn't have access to healthcare. I am never going to let my vote deny people access to good healthcare.
I wish I had more time for this one. There are things that we can do. Now, I'm not an expert in this plan. Mine need to be vetted, but here's some ideas. Catastrophic insurance. If everybody gets it, not only by force, it would lower prices. You could even absorb those people that are terminally sick or have diabetes. So no ER without it. You can't go to the ER for a stomachache, no matter who you are. Direct billing with no insurance interfering between patient and doctor to bring down prices. Tort reform and tax-free medical savings accounts so people can cover their deductible or some of their exam fees. Now, there are ways, and we can certainly open up a dialogue on this, but this was shoved down our throat, this bill. And I read quite a bit of it, the original one, it's been tweaked a little bit, but it is frightening the amount of power given to the Secretary of Health and Human Services. This is not a health reform bill, it is a power grab. She has unlimited, undescribed powers. This is a total invasion of your privacy, your medical records, your bank accounts, and your private files. The cost, if they're saying it's going to be $1 million, we should know that it's probably going to be about $8 million. And since they were putting everybody on this, and that says you cannot expand, add more hospital beds, get more doctors without jumping through these hoops, and you may or may not get approval, there's going to be rationing. There's no way to avoid it. It's a bad, bad way.
If you would please refrain from applauding. I know that you get excited about what's going on, but please refrain so that we don't lose time on that. Thank you. Mr. Taylor.
I can recall the arguments going into this health care bill where insurance companies were taking advantage of us. They were just hosing us. Pharmaceutical companies were doing the same thing. I don't know if anybody's followed the health care reform that's taking place, but insurance companies' stocks have been skyrocketing. They're doing very, very well. Pharmaceutical stocks are going up as well. Insurance companies are provided a 15% profit margin in this health care bill going forward, like a PUC is guaranteed a profit. There's no cost control in this health care reform bill, none at all. Hence, we need to repeal the bill. That's the first thing we need to do. We are a very giving, very generous nation. We can provide health care for everyone. That is a possibility. It's within our reach. But the bill that was crafted in 1,200 or 12,000 pages, however many pages it was, this is not the right bill, ladies and gentlemen. We need to repeal the current bill. We don't need to reform our educational finance system included in it. We don't need to add 10 times more IRS agents to police everybody. We don't need all that. That's just more government, more intrusion, less privacy. Thank you very much.
Thank you, Mr. Taylor. Final question, and then we will allow you for closing remarks. Oh, I'm sorry. I forgot we started with Mr. Petersen. Okay. Go ahead.
Thank you.
Sorry.
I agree a lot with what Mary said. And at my website, I have a section on what I call Obamacare and the law of unintended consequences. A lot of things happen with that bill that you think are just going to be aimed at the people earning lots of money. There are a lot of cutoffs of $250,000 and above. If you earn $250,000 or above, you're going to be taxed 3.8% on your interest income, dividend income, your royalties, and your rental income. Now, what happens if you live in a rental? Or what happens if Costco's renting the building that it's in, or Safeway? Well, they're going to get hit because most of those properties are owned by partnerships. I've been in tax long enough to see a lot of those partnerships. We have a lot of real estate partnerships here in the United States, and a lot of them are owned by individuals. Those individuals are going to get assessed a 3.8% tax. Don't you think they're going to say, well, let's raise the rent the next time we come up with the lease? If they do that, you're going to have to pay higher prices wherever you go, whether you're renting an apartment or you're buying goods at the grocery store. Check my website out, Carmel Ron. I've got a section there. I believe that it shouldn't be killed, but it does need surgery. It does.
Thank you.